Hi, I'm Dr. Nicole Anderson, and I want to teach you a way to relieve pain and stiffness in your knee just using your own hand. Now, something that a lot of people don't understand about the knee is that the knee is usually the victim, not the cause. Now, you might have had an injury where you were like, oh, I definitely injured my knee doing something. I felt a pop or I felt a sharp pain in my knee when I did X. Well, that's a little bit different story, but a lot of times when people have knee pain that just kind of seems to come out of nowhere, or they woke up and they had it, then it's usually being caused by something else. And a really common cause of knee pain that people don't realize is it can be coming from impingement, meaning kind of compression or tension on a nerve. And that nerve impingement can be happening in your thigh, it can be happening in your hip, or it could be happening up by your back. And it's super common for people to actually even have swelling in their knee, to have knee pain that's actually just because the muscles around the knee have gotten weak because the nerve that feeds those muscles is impinged or pinched, and that means that the knee joint is getting a lot of, it's sloshing around because the muscles aren't stabilizing it properly, and it all goes back to, we got to get to the compressed nerve, release the nerve so the muscles can work right, so the knee joint stops getting so much sloshing around. And it's really common for people to have meniscus tears in their knee and have no pain and no symptoms if you have adequate stabilization of the knee. So whether you have a meniscus tear from an injury or whether you have a meniscus tear just from wear and tear, which is super common, that people after the age of 50 have meniscus tears just from wear and tear on their body. Nothing specific happened that they can remember, but now they have a tear. And it's really common to be able to get well with physical therapy. And if the therapist only focuses on the knee though, they might be missing the true cause. The true cause could actually be coming from a pinched nerve that's up in the thigh or up in your butt or up in your back that's making the muscles not work as well. So that's why the symptoms are continuing. So if you've had physical therapy for a while and you haven't noticed an improvement or you haven't gotten all the way well, that might have been missed. So that's something that, we always look for here, we always address. All right, so back to the knee. So if you want to release pain and stiffness in your knee, there's a really simple way to do it using your own hand. There's a way to do it using a ball and a roller and all that stuff. But let's say you don't have that stuff and you just want to make a difference in your knee. Well, you can do this. Regardless of what the cause of the knee pain is, this will help, okay? So what we're going to do is we're going to take, and you're going to bend your fingers like that. And we're just going to do some little movements right underneath your kneecap, just like this, okay? All right, and then you can do some circles. Use your finger pads. Just do some light circles below your knee. You don't have to push hard because what we're trying to do here is we're fluffing and buffing our fascia just to loosen up the fascia. Okay, we don't need to blast the fascia to make a difference. We're just fluffing and buffing it. And why? Because if you fluff and buff your fascia with just some little circles like this, what it does is it stimulates glycosaminoglycans and fibroblasts that are part of your connective tissue matrix to help pull fluid into the matrix so that the layers slide and glide better. So something we've learned in the last 15 years or so about knee rehab is that if you've been told your patella or your kneecap's not gliding correctly, well, that's actually a problem most often coming from the hip. And it could be you have a pinched nerve that's making it so these muscles don't work as well. It could be just that you need to have the right exercises to strengthen these muscles so that your knee can be stabilized right. But that tracking issue, if you put a brace on it or if you put tape on it, it's going to have a temporary benefit, but it's not going to solve the root of the problem. But what this work does with our fingers, we're going to do some circles around the outside of the kneecap, is it just loosens up that connective tissue that's gotten unhappy from the kneecap not being able to properly glide because of the muscle weakness. So what we're doing here is we're just helping out the victim, but the true cause is probably somewhere else, as is usually the case with the knee, okay? All right, so remember, even if, so we're gonna do circles on the inside here, all along the inside of the kneecap. Remember, even if you've been told you have a meniscus tear, even if you've seen a meniscus tear on an MRI, there's very few meniscus tears that actually require surgery for you to recover full function of your knee and pain-free activity, doing everything. I actually have a meniscus tear in my knee and I surf and I run and I can do everything because I have proper stability in my knee, and the meniscus tear is kind of a non-issue. So again, if you have a tear, don't rush to surgery because oftentimes you can get well without it. And surgery involves a whole nother level of stuff that you don't want to bring into the equation if you can avoid it. All right, so now I'm making a fist, and I'm just doing circles around the top part of my knee. Okay, and then now I'm gonna do some circles on the inside of the knee, on my adductor muscle. So a lot of times when you do these circles, you're gonna be like, oh man, that is sore, okay? And you didn't even know it. Well, it's because it's gotten really taut, because it's being relied on more than it should, because the muscles out here are weak. That's most of the time the case, all right? But what we're gonna do is we're gonna just juice it up, because it needs it. It needs a little extra love. But in order to solve this problem permanently, we're gonna wanna do the right strengthening exercises for our hip. All right, so let's do some on the inside here, in the middle. Okay, circles, you can go up and down, side to side. All right, and then up high, circles. It's good to target right where the muscle and the tendon attach, because that really helps to release everything in between. Okay, so I'm going really up high, and I'm gonna go in toward my body and out, and I'm gonna go up and down across the fibers of the tissue, okay? And then the next place that we wanna address is we wanna address there's a little area here, not in the front of your thigh, not on the side, but right in the corner, where trigger points like to live, okay? And trigger points are these areas of the fascia where the electrical activity is going crazy, it's going haywire. The reason is because there's usually been too much activity in that muscle, and it's gotten worn out, it's gotten tired, it's gotten overused. So we want to do something about that to kind of loosen it up. But again, the treatment of the root cause is going to be proper strengthening of the glutes, and proper strengthening of the core, and proper strengthening of the hamstrings, along with the quads. But we need to make sure we're getting proper activation of these other issues that tend to not be properly activating. All right, so what we're going to do is we're going to do some circles right down that front corner. Okay, and what I'm doing is I'm just exploring to see if anything feels tender. And if there's a tender spot, what I'm going to do is I'm going to just go up and down, side to side. I'm using this part of my knuckles right here. So I'm just going to go up and down, side to side. And I'm just going to hold here and take a nice easy breath, let the tissue adapt. About 3 seconds or so, and then move it away. And that's going to help release that trigger point. You can do it wherever you find a tender spot in here. And the really cool part about this is releasing trigger points in this area will release the fascia in the knee, okay? So you can usually get a pretty good release doing this with your hand, and then there's other things we can do in the clinic to get an even better release if it doesn't release all the way, doing it this way, okay? And it's important to know that a lot of the things that people think are strengthening their glutes and think are important for strengthening their knee are actually okay, but there's better things. And if you only are doing, say, squats, for example, and deadlifts, you're not doing enough to stabilize your knee. There's a lot more stuff that is really important to do to stabilize your knee, a lot of things that are really necessary. And if you're not doing them, then you're going to continue to have knee problems. And again, bringing it back, your knee problem might be coming from your back. We treat this all the time. People are told they have a meniscus tear, they're having swelling, they're having problems with their knee, and what we do is we release the pinched nerve in their back or their thigh, and we strengthen their core adequately and get their glutes firing properly again, and now their knee problem goes away. So we actually end up doing very little to their actual knee to solve the knee problem. It's very, very common. We pretty much treat almost one person a day with this issue. It's so common. So anyway, if you have any other questions, please reach out to us. Be happy to answer any questions that you have, and thanks for watching.